101.9 FM.
Minutes past 2 from the studios of Adaba 8.9 FM. Good afternoon, and I apologize that the roundtable this afternoon is coming behind schedule. My name is Oladimeji Daniels, and this afternoon we'll be talking about something that is of great concern to members of the public. And if you're wondering, coronavirus, COVID-19 is finally here. At some point, we were watching it on the news where airing news about countries like China, South Korea, and the other places. But now, finally, coronavirus is there. And the index case is an Italian who we learned is being quarantined somewhere in Lagos State. Well, the first case was reported in China on the 30th of December 2019. At the moment, as of this morning, the death toll from coronavirus has hit 3,000. On February 14, the World Health Organization Operation Support and Logistics started dispatch of laboratory COVID-19 testing kit for 56 countries. And from WHO Daily Situation Report, as of this morning, no new countries reported cases of COVID-19 in the past 24 hours. Around 56 million people have been quarantined in China alone. And must not forget the impact of this coronavirus on world economy. Talk about trade and all of that. The International Air Transport Association says that the COVID-19 outbreak is expected to result in 13% full-year loss of passenger demand for airline operators in Asia Pacific region. That's a revenue loss of $27.8 billion in this year for the international carriers. And this revenue loss is just for a corner of the world. Well, symptoms of this coronavirus, as we learned, can begin with simple cold and cough and mild fever, tiredness, aches and pains, nasal congestion, runny nose, sore throat, diarrhea, and if left unattended, it can lead to serious respiratory illnesses such as pneumonia. And symptoms we've learned vary from person to person. Some people become infected and they don't show any symptoms. We also learned that around 80% of the people who have been infected have recovered. And there are some people who get infected and they don't even show any symptoms and they recover without any special treatment. Around one out of every six people who get infected become seriously ill and they develop difficulty problems. Well, I'm not the only person on the show this afternoon. Let the expert talk about this. I'll be asking them questions. You also get the opportunity to ask them questions, because I know some people are scared. The federal government has said people should not be scared, that everything is under control. But before I introduce my studio guest, let's listen to the Minister of Health. He addressed another press conference this morning, and let's listen to what he said.
As at the 1st of March, there is no new confirmed case in Nigeria. About 13 or 14 tests have been done, and except that one patient, no other person has been diagnosed. It is important for all Nigerians to focus on facts and not on fear, and not to generate panic. There are 3 countries affected in Africa: Egypt, Algeria, and Nigeria. There is ongoing community transmission mainly in 5 countries: China, Korea, Japan, Italy, and Iran. Advice for Nigerians: we should all remain calm and avoid panic at this time. Everyone is to regularly and thoroughly wash hands with soap or use alcohol-based sanitizer to disinfect your hands. Maintain 1 meter distance between yourself and anyone who is coughing or sneezing. This is called social distancing. Make sure you and the people around you follow good respiratory hygiene, which means covering your mouth and your nose with a handkerchief or tissue when you cough or sneeze, or if you do not have any of those immediately at hand, coughing or sneezing into your bent elbow. Immediately dispose of the used tissue after use. If you are feeling unwell with symptoms such as fever, cough, difficulty in breathing, stay at home. Call NCDC toll-free. The number is available 24/7. 0800-97000. This number continues to 0102 to 010. Do not indulge in trying to treat yourself. If you are not better after a few days, call at a hospital. Stay informed on the latest development about COVID-19 through official channels, including Lagos State Ministry of Health, NCDC, and of course, Federal Ministry of Health, Media Department.
Okay, you just listened to the Minister of Health talking about, but that was the latest briefing we had this morning with members of the press about coronavirus. Let me welcome my studio guest. I have the Honorable Commissioner for Health in Ondo State, Dr. Wahab Adegbedo. You're welcome on the program.
Thank you. Good afternoon.
I also have Dr. Stephen Fagbemi, an epidemiologist. You're welcome on the program.
Good afternoon. Thank you.
Let me begin from the Honorable Commissioner. I saw a press statement that you issued. I know some people, there are a lot of misinformation flying around. Some people say Africans can't even get infected. I've had people who say, I was just talking to somebody who said alcohol kills it. Some people say Africans can't get infected. Some people cannot get to Ondo State. What are the measures that have been put in place by the Ondo State government?
I think one should probably dismiss some of those insinuations that Africans cannot have it. That's not correct. Everybody is exposed to it. It doesn't have to do with race. Whether you are African or you are European or something, everybody is susceptible to this kind of epidemic. And as far as the issue of preparing for coronavirus, what we call COVID-19, I think the state is on it. We've set up a stakeholders committee.
There's a committee in place now.
Yeah, there's a committee in place.
Are you a member of that committee?
Yes,
definitely.
So that is working around it to make sure that things don't get out of hands. We have activated our IDH. Incidentally, we have the IDH here.
Okay.
What we call Infectious Diseases Hospital.
Okay. Why is that in Ondo State?
That was built during the time of Ebola.
Okay.
So, you know what we are talking about.
So it's still in place.
What we are talking about too is a viral infection.
Yes.
So that's it's a viral center, human virology center that is supposed to take care of issues like this. And don't forget too, we have been battling with Lassa fever. So thank God it's under control.
I'll still ask you questions about it because everybody seems focused on coronavirus now. But I know that Lassa fever is still a risk in all those.
Right. So we have been battling with Lassa fever, and we have got a lot of experience, and that is the experience that we have with that we are transferring to the issue of COVID-19. So that what I mean by that is that we have trained staff and so on and so forth that can handle this kind of situation. But like you have said, I met you talking about the presentation. Yeah. This is a flu-like presentation generally. That is, people will have chest pain, cough, a fever, and all the rest. And one of the major complications of this is respiratory issues.
Yes.
That is, they can have respiratory embarrassment, and that's why the issue of getting what do you call it now, respirators and ventilators to actually deal with that at that complex level. So we are working on that. Should in case we have this kind of presentation, the disease can be managed generally at any facility.
Okay.
Yeah, it doesn't have to be IDH.
Well, what about infections? Because definitely there will be other people in such facilities.
Such facilities have been strengthened to ensure that especially the health workers are adequately protected.
You have a separate place, separate work for such people.
Probably quarantine them, put them somewhere, and manage. Some of them, especially mild cases, can remain at home.
Yeah, some don't show
and they can get cured at home.
But that does not mean they cannot infect other people.
That does not mean.
Even if they don't show symptoms.
If they don't show symptoms, I think that's one of the dangers of this problem. That is, some people will not show symptoms. They will not know that they have issues. So they will be in position now to transfer that to others around. That's why at this point in time we are advising people to avoid crowd.
Yeah, crowded places.
Yes.
Yeah, that's important.
Like
all these football, viewing centers, where people shout and...
So we should avoid crowd for now. And you have said about hand sanitizers.
Alcohol-based hand sanitizers.
Yes, we need to wash our hands and regularly.
Under ironic
so
because some people don't know it's under.
We expect all public places now to have sanitizers, so that when you enter, thank God I saw one when I was introducing your facility. So I think every public place you have it. We are trying to do a lot. I'm just coming from Mr. Governor now, because myself and the SAT, we called us for a short meeting, and we have analyzed what we need at the moment to ensure that we are fully prepared. And Mr. Governor has agreed to our request, and I think we are good to go.
Okay, I was listening to the Lagos State Governor, Sanwo-Olu, last week when he was briefing the press, and he said at the moment they have a 100-bed facility. Right. You talked about the IDH in Ondo State. Right. What's the capacity?
That center can...
30.
That 30. Center can hold 30 for now.
Okay.
And there's room for expansion. Like I said, many facilities can actually serve as treatment center. It doesn't have to be IDH alone. It's the only thing that those centers must be aware of what they are dealing with and protect themselves.
One of the risk factors is the health workers themselves. I'm sure you can really with what I'm saying. You're also a medical doctor. One of the things that the World Health Organization says is that from time to time there should be training about this particular issue for health workers, because somebody walks into a hospital and the doctor, without wearing glove, without doing anything, tends to maybe he's just presenting body temperature,
what looks like ordinary malaria.
Right, so what are you doing to ensure that these health workers, because if they get infected, they may even infect other people who are not infected, who just come to the hospital maybe for just ordinary headache, and they infect them in the process? What are you doing to ensure that the health workers in Ondo State get properly properly
sometimes because of the issue that we have with Lassa fever, these people our health workers have been trained. Personal protection.
All over the state?
Yes, all over the state. I mean, they should be conscious of it now because the information has been passed on.
They should. Let me underline. They should. Yeah. It does not mean they are.
Right, you are right. But I think we expect them to know now because this information has been disseminated. Workshops have been held.
Because even the World Health Organization lists hospitals as one of the places people can get infected. And that's why even hospitals from time to time should be disinfected.
Right.
From time to time.
You are right. And that's what.
So is the Ondo State government doing that?
We are doing about that. In fact, we are about procuring some all these things now to add to what we have before, so that these hand sanitizers and the personal protective something are available.
Now, I wasn't at a forum in about 3 weeks ago, and we're talking about some of these diseases and what people can do in workplaces and at home. Now, I brought to their attention a scenario. What if in your house, you're the kind of person who believes in hygiene, you take care of your kids very well, but these kids will go to schools.
Yeah.
They will play with their mates who are from other homes. And you don't know what happens in these homes. Definitely. So that means the school is also one place that government should look at. So definitely, and teachers, for instance, a kid in your class has been coughing for 3 days. What stops a teacher from separating that kid from the other pupils in that class? A teacher who does not know will definitely keep that kid in the class, because I had a situation, was it last week or 2 weeks, that happened there about last time in Ondo State. The kid came home and told his mom that somebody has been coughing in their class, and the mom didn't listen. I don't know, the boy got it, and the boy who was coughing in his class died. So what are you also doing to talk to school owners, teachers, to ensure that...
Yeah, thank you. I told you a few minutes ago that we had a stakeholders meeting. It was multi-sectoral.
Okay.
That is Minister of Education, Minister of Agri, Minister of Information, and a lot of MDAs were involved, and they were present because each MDA has a role to play. Like the Minister of Education, what you have just spoken about is in the purview of Minister of Education, and that information has been sent to them, so we expect.
But are you sure your colleague in that ministry that this thing is trickling down?
All right.
Because I go to schools, I see what is happening.
All right.
You could go around schools in Ondo State. How many of them even have hand sanitizers that we're talking about?
Right, so we've passed the information to them, and maybe it will not be out of place for us to go out along.
I think you should do that. I think you should do that. You see what is happening.
We see what is happening in those various schools, because it's also these schools are where you have a lot of a crowd, and I think
especially during break time, they play football, they sweat.
What we are talking about has to do with crowd.
Okay, let me turn to Dr. Stephen Fagemi. Let's get down to the nitty-gritty now. What is coronavirus? Because some people don't even know. They just hear it on the news, coronavirus. What is it, and how does it affect people?
Well, first of all, coronavirus, there are groups of viruses that are called coronavirus. There are many of them, and they are related. These flu-like viruses, there are many. And the particular SARS, MERS, and all that. In fact, when this one started, when it was first discovered, the name that was given to it was novel. That is just another new strain of coronavirus. But I think WHO has properly given it its own surname now, which is COVID-19. You know, just to link up with the year 2019 that it starts. It's a virus that particularly inhabits the respiratory tract of man, you know, so stays in the respiratory tract, upper, lower, and it presents with the normal flu-like symptoms, some catarrh, cough, shortness of breath, you know, in fever. And then, like the Honorable Commissioner alluded to, and you have also said in your intro, then the patient may get worse and then go into respiratory failure. But many of them, just like the common flu, many people have the flu and they just shake it off within a few days. Yeah, so 80% are not symptomatic at all.
But does that not mean that does not mean they cannot affect other people?
No, it doesn't. Now, what is particularly interesting in this particular COVID-19 is something that is not common with other viruses. The fact that they have noticed that a certain percentage of people who are not showing symptoms can infect others. That's not a very common trait. Usually, when people are not showing symptoms, they don't infect. That's what we know in most epidemiology. That's a standard thing. And that also guides some of our principles of prevention and interrupting transmission, because we know that once, for instance, in Lassa fever, we can always bet it that as long as the patient is not yet showing symptoms, that is the incubation period, the patient cannot infect another person. But for corona, it's a little bit different because of this small group There are not that many, but it's still sizable who have been known to infect others while they are not showing symptoms. Some of them may later show symptoms, but in that period where they are yet to show symptoms, they infect others. So that's why the issue of quarantine, people are very, very strict about it. You know, we can't take chances. So that's what the coronavirus is. The mortality rate, that is fatality rate, is about 2%.
Yes.
You know, but we always say 2% fatality in developed country may not be the same in Africa. We don't have countries. We don't have the facilities to actually take care. So it may be a bit higher here. But fortunately for us, we don't seem to have as many cases as they have in the other
because the administrator said this morning that there are no new cases apart from the index case in Nigeria,
so
the Italian.
And but I also know that we need to screen many more people. Perhaps the problem that the Americans have, which they have addressed, was they weren't screening enough. But now that
but I read it on the news this morning that a death has been recorded in the US now.
A death has been recorded in the US. Yes. So the Americans, they are beginning to screen many more, and I guess we also need to actually.
We're not doing that in Nigeria. If you go to the airport, we're not so. In some countries with cases like this, or if you're coming in from a country that has been dying infection, in fact, I read about a particular country. They provided a separate gate at the airport for anybody who's coming from a country where there is a breakout of the infection, but we don't seem to be doing that in Nigeria.
Well, that's
and there are thermal screening.
Yes, that's what I want to. That's partly, well, according to the Minister for Health, which he was given the press an interview yesterday, and he said that because of this issue of whether everybody is being screened or not, he said what happens is that in Murtala Muhammed Airport and perhaps in Nnamdi Azikiwe in Abuja, they actually have thermal screening that you pass through unknown. So people expect that
how did the Italian come in?
Well, I can't.
He came in 24th.
Yes.
And then he started showing symptoms 26. How did he come?
So
how did he come in? He must have had high body temperature, and that's how it seems possible.
It's possible, but then it's also possible that he may not have started having fever at that time. It's possible, we know, until we get the facts of the case. So, but what the minister was saying is that we have this thermal screening that people just pass unnoticed. So it's not every time that you have to point the.
You believe Nigerians should take his word for it? Because a lot of things going on in Nigeria.
Well, I mean, we until we
been to airports. Somebody was still writing this morning that in the last 1 week he has been to 3 airports in Nigeria and doesn't see anything.
Well, I guess but one thing I do know is that Nigerian government has tried.
Okay.
In fact, initially when they started talking about this coronavirus, some of us felt, we have our Lassa issues. But with the benefit of hindsight now, we are glad that they took it serious as early as they did. There were a lot of conferences, epidemiologists were talking about it. In Lagos, they were already, because we know that as the most populous country in Africa, there was no way somebody will not show up. And having learned from the Ebola, and when it finally came, came in undetected, fine. Maybe not. The response has also been rapid. You remember that a few weeks ago, before this case, the Federal Minister of Health was already in Lagos looking at these facilities, reviewing what was on ground, where the holding area will be, the treatment, the infectious disease hospital, the Adaba has been upgraded. It's unlike Nigeria. If it was before, they would just start building it now. So we had all this.
Would you have suggested shutting that airport? There are countries who have cancelled flights. There are countries like that, and there are some of these countries. Some do not even have this infection, and they're already cancelling flight. They're already screening people for serious screening.
WHO will tell you that when they announced that they have classified coronavirus as a public health disease of international concern, but they also said that they are not asking that people close their borders and restrict access. And
Nigeria can't do that effectively.
Because the point is
about 1,000 entry points in Nigeria, so illegal.
If you once you close down the airport, you only encourage people to come in illegally. and that is going to be
people are already coming illegally from time to time in Nigeria.
Yeah, but at
a lot
least,
of illegal entry points.
Well, because of the nature of this outbreak, the epidemiology of it's a bit simple, not too complex. Like we know, one, you can only come into Nigeria 3 ways: by land, by sea, or by air. Chances of somebody with coronavirus coming in by land is not very high. One, because we know there is none of our neighboring countries have it.
Yeah.
So anybody the closest you can come by land is somebody in Algeria, which is far, or Egypt. So we can almost assume that anybody traveling by road, well, if you have coronavirus, by the time you get somewhere, it will show. So that's number one. Number two, by sea. The shortest possible time for people to travel by sea to Nigeria is about 3 weeks. So whatever you pick,
it depends on where you are coming.
Well, it depends. But again, if you are not coming from any of the West
What
African,
if you are coming from Egypt?
But if you are coming from Egypt, you spend longer because you have to go all the way around the West African coast to get to Nigeria. So the easiest way you will come in, fastest, scary, is by air. And a lot of attention were paid. Well, I mean, nobody knows to what degree of compliance that is to making sure the international airports, are ready. And the Lagos that we feared was going to be where to come through, Lagos and Abuja, and eventually it did come into Lagos. Lagos had tried. We must give credit to them. They have a 100-bed facility. Well, we have a 30-bed facility in Ondo State, but we are not a 25 million state like Lagos.
Yeah.
So we are just a fraction of the population of Lagos. So I believe one thing that's helped us, like the Honorable Commissioner said in Ondo State, is that we battled outbreaks, very serious outbreak. Lassa fever outbreak is a very serious outbreak, and we've been battling it for the past 3 years consistently. Very serious outbreak. So we have. And the mode of managing this crisis, the science is almost the same. Just little, it's the same thing. You isolate, you quarantine, you contact trace. We have more than we have the technical know-how to do those. We have people who are trained on the daily basis. As we speak now, we have contact tracers who are following Lassa fever patients and their contact. So we are not just training people to do those things because it's been part of us now. We have health workers who run the risk. Lassa fever is as deadly to the health workers as coronavirus, even though it's not airborne. So a lot of IPC training has been ongoing. We are not there yet. Sure, coronavirus takes it a notch higher, being airborne. There are things we need to go back and look at the gaps. But I would say that the outbreaks we have had in the state, has really prepared us. We are not just camping around. We have an EOC. That some states are just activating their EOC. Some are even just setting up EOC. We already have an EOC running for more than up to 2 years now. So, and it's just the same, just bringing in new people, more people, fresh hands, and fresh ideas.
Let's talk to the people now. And I also want you to also say it in Yoruba.
Yeah.
The symptoms.
Okay.
The symptoms, I want us to talk about the symptoms. And I know that people have this attitude. Sometimes people around you are showing the symptoms. They keep the person at home. I want you to do that in English and Yoruba. You advise to them if anybody around them is presenting symptoms, and then you talk about the symptoms.
Okay, the symptoms for coronavirus, very simple. You have cough, you have catarrh or running nose, and then you have fever. The fever may not be much, maybe slight fever. And then there is some shortness of breath, difficulty in breathing. Those are the symptoms. And these are symptoms that are very common. So what we want people to do now is that we don't want people to just ignore it. Usually we experience these symptoms, from time to time. But now that there is an outbreak all over the world and we have a case in Nigeria, if anybody is having these symptoms, don't do the common thing that we usually do. Just buy something over the counter, go to a health facility, make sure they properly look at you. And if anybody is in your house who is doing this coughing, it's nice to make sure you get the person out to go for treatment. They may give you drugs and not keep you in the hospital. But the Ministry of Health, Federal Ministry of Health, and the state, we are saying anybody coughing and sneezing now should please stay at home. You know, I mean, even if you think it's not so serious, they've given you are using drugs, it's no longer socially acceptable to be coughing in the public. You know, so they should stay. And if they are getting worse, come back to the hospital. So the necessary tests. Fortunately, the Nigerian Center for Disease Control have told us some of the laboratories where we can get this coronavirus can be tested. We have one very close to us in Edo State, or we can take the option of going to Lagos. We are lucky. Some states may have to travel several hours to get to the nearest lab. So that's the advice. So far, we are hoping and we are trusting God and we are preparing that this will not be a very bad one for us in Nigeria. But and I believe that we should be optimistic.
Let's talk about the safety precautions. I read things about, you said staying at home, but the World Health Organization also released some like staying 1 meter away from anybody who's showing any symptoms. No handshake,
keeping away from crowd.
From crowd, wearing face masks. But I was listening to somebody this morning who said, okay, even if you wear face mask, that will only protect your nose and your mouth. What about your eyes?
Yeah, the WHO has specifically said that they are discouraging people that are not infected from wearing face masks. Two things have happened. Because everybody is using face masks, those who really need it are not having access to it now.
It has become expensive.
So those people, they are hoarding it.
Even sanitizers.
Those who really need face masks, there are two sets of people: the healthcare workers and those who are coughing. If you are coughing, you are sneezing, then you can wear a face mask to, you know, keep some of the things that are coming out.
The droplets.
But for other people, that social distance, very important. You know, keeping that minimum distance, washing our
1 meter.
1 meter. Washing your hand all the time, as many times. Under running water. And then one other habit that we all need to learn the hard way: stop touching your face. That's a very difficult one.
Your eyes, your nose, your mouth.
Stop putting your hand on your face. So, and we all need to do that and do that. I mean, practice more and more and more often. And that's where what you discussed about the Ministry of Education is important. These are some of the things we are now trying to inculcate through the schools. We're partnering with them, with the students, the children, the pupils. You know, we never learned these things when we were young, but we need to learn it. The hands are very good at transferring things. Very, very good. The fingers, very, very good at picking things. And sometimes people can cough on the surface. We know that some of these viruses can stay 24 hours, you know, plus or minus.
But I think I read that coronavirus does not really last long on hard surfaces. Yeah.
But sometimes if there is moisture, there are things that can facilitate it. So, and we know we touch, you just go to the public areas, you touch railings, you touch doorknobs and stuff like that. So we should keep washing our hands, you know, and then if somebody is coughing, they should maintain the cough etiquettes, use a handkerchief. Don't just cough
into your elbow if you do not have handkerchief.
Yeah, or excuse yourself from it. And then we should make sure we don't stay in confined places and congested rooms, and ventilation is very, very key now. I believe if we do that, God helping us.
Can we quickly say that in Yoruba, because of our people who may not understand, before I go back to the Health Commissioner? Can we quickly do that in Yoruba?
Fún àwọn èèyàn wa tó wà nílé, ibà corona tó wà níta yìí, àwọn ọ̀nà tó máa ń fi farahàn gẹ́gẹ́ bá ti ń gbọ́, òun náà ni wípé ikọ́, ọ̀fìnkìn àti ibà, ìyára gbígbóná díẹ̀, tó bá wá wọra, ẹnìyẹn ó lè wá rí pé àti mí kanlẹ̀ ó lè jẹ́ ìṣòro. Bọ́ ọ̀nà tó máa ń gbà farahàn nìyẹn. Tí a bá dẹ̀ ti ń rí àwọn àmì wọ̀nyí, ohun tó yẹ ká ṣe ni pé ká lọ sílé ìwòsàn. Tó bá ṣègbà kan ni èèyàn lè sọ pé màá jókòó sílé àbí kí n ro oògùn ládùúgbò. Ẹ má jẹ́ ká ṣe bẹ́ẹ̀. Ẹ jẹ́ ká lọ sílé ìwòsàn, kán béèrè ìbéèrè lọ́wọ́ wa, kán dẹ̀ fún wa lóògùn tó dájú tá a máa lò tára wa fi yá. Wọ́n lè dá wa dúró àbí kán ní ká padà lọlé. Tó bá ní ká padà lọlé, ká jókòó sílé. Ẹnikẹ́ni tó bá ń wúkọ́ léraléra, ìjọba ti sọ pé irú ẹni bẹ́ẹ̀ ó dáa kó wà nílé, kó má lọ bí iṣẹ́. ẹ má jẹ́ kó má lọ síbi táwọn èèyàn pọ̀ sí.
à ń lọ sí church ni à ń lọ sí mọ́ṣáláṣí ni.
ẹni tó bá ń wúkọ́ léraléra kó jókòó. àwa tá a dẹ̀ jẹ́ ọ̀gá ilé iṣẹ́ náà táwọn èèyàn tó bá ti ń wúkọ́ ẹnì kan máa lọlé. ẹ má sọ pé ká fi tipátipá
ó gbọ́dọ̀
ṣiṣẹ́. àwọn teachers tó wà ní school tọ́mọ bá ti ń wúkọ́ ẹ jẹ́ kó máa lọlé. ẹ tètè pé àwọn òbí ẹ má jẹ́ kó máa wúkọ́ sí gbogbo àwọn tó wà ní class. àwa náà tá a dẹ̀ ń rìn téèyàn bá ti ń wúkọ́ nítòsí wa ká ṣe kí ni ká jìnà sí wọn. ẹ má jẹ́ kán wúkọ́ sí wa lára. dẹ̀ ká máa fọwọ́ wa lóòrèkóòrè pẹ̀lú omi àtọṣẹ. omi tó ń ṣàn ni o, omi tó ń ṣàn kì í ṣe pé ká máa kọwọ́ bọnú abọ́
lábẹ́ omi ẹ̀rọ
tó ń jáde. àbí tí àbádẹ̀ ní ẹ̀rọ tó ń jáde yàn kán lè máa dà á sí wa lọ́wọ́ ká gbọ́wọ́ wa sísàlẹ̀. a lè ṣe bẹ́ẹ̀. ká dẹ̀ máa yàgò fún àti máa fi ọwọ́ wa sí ojú. mo fẹ́ yín ojú, mo fẹ́ yín imú, mo fẹ́ yín etí, mo fẹ́ ta yín. gbogbo àwọn nǹkan yẹn tó lè ká máa fi kán ta yín. gbogbo àwọn nǹkan wọ̀nyẹn ó lè fa ewu fún wa.
Okay, let me turn to Honorable Commissioner. We'll open the port in a moment now, but let's talk about worship places. You said the meeting you had was multi-sectoral. Did you also involve religious leaders?
Incidentally, in that meeting, there were no religious leaders there.
Because in churches, I was saying earlier, pastor would say, shake seven people and tell them it is well with you.
Yeah.
And then you keep shaking people around, say it is well with you. And then pastor will tell you again, place your hand on your head and say it is well with me.
That's why
That's
why we have been sensitizing people now that we should avoid crowd. And that includes vigil and all this where you have a lot of people dancing, shouting and so on and so forth. I think we should, for the safety of our lives, I think we should avoid crowd for now.
Okay, let's open the port now. The number to call is 0816-251-9991. 0816-251-9991. Okay, let me take it slowly. 0816-251-9991. 0816-251-9991. You can call in and ask the Honorable Commissioner any question. You could talk in Yoruba and English. Hello?
Hello? Yeah. Good afternoon.
Good afternoon, please. Your name and where you come from.
This is Pastor Festus Alabi from BP in Edo.
Okay, go ahead and ask a question.
In Edo State, yeah. Doctor, I've well heard you. I understand all what you have just taught and teach us.
Hello, could you stay away from your radio set? Or you turn it down completely?
Okay.
Because I'm hearing my own voice there.
I think, yeah, I have done that.
Okay.
Yeah. So, may God bless you. But notwithstanding, concerning the church, the vigil, the crowd, I understand what is always putting on in almost all the hospitals in the world, that the doctors, they treat, but God heals. Now, when it comes to church, that is spiritual issues. And we have been praying over the coronavirus and the Lassa fever and otherwise. And I know that God is in charge, God is in control. But notwithstanding, with what I have heard from you this afternoon, by Sunday, or probably today, this is my half service, I'm going to teach and also extend it to the church. Because I'm the hand washing and other things.
God bless.
So I've really learned a lot. I'm not going to ask any question, but I'm going to add it, contribute it, and also teach the church so that they will be very, very much careful. God bless my doctor.
Thank you, sir. Thank you, sir. We are very grateful.
One question before we take another call. I know in some places there's a provision of flyers and all of that, posters put up and all of that. Is the Ondo State government thinking of doing that?
Yes.
In public places, putting in flyers in schools and all of that.
Very shortly, those things will be available for distribution.
Okay. Let's take another call. 0816-251-9991. And don't worry, if you want to speak in Yoruba, you're free to do that.
Hello.
Hello.
Yeah, good afternoon.
Good afternoon. Please, your name and where you calling.
This is Mr. Bayo Olayinka from More.
Okay, go ahead.
I appreciate what you people are doing over there, but I want to ask this question. The symptom of this coronavirus, why is it always the same thing with that of Lassa fever? Normal fever and Lassa fever and coronavirus, how come is the same symptom? One cannot easily identify this. Please, I want the doctor over there to expatiate on the symptoms for us so that we know the more. Thank you. God bless.
Honorable Commissioner for Health, would you like to respond to that?
Thank you. We are talking about viral infections here. Lassa is a viral infection. COVID-19 is also a viral infection. Their presentation are not the same, and they are not exactly the same, but they may be similar. What you have in COVID-19 is more or less upper respiratory tract infection, where you have the patient will cough. We don't have that and Lassa as such. So the patient.
Or you could have that in common fever.
Common fever, what we call the flu that we are all used to. So that's. But
I think the advice is that if you have these symptoms, don't just stay at home. Go talk to a doctor.
That's why the issue now is that what our people will normally refer to as common cold may no longer be common cold.
At home and all of that.
They may no longer be common cold now.
I'll be using rub.
So therefore,
go to the clinic.
If we have, I think the best thing is to go to the clinic. You have also heard that when somebody is coughing, we are talking to the organs in the offices now, that when your staff is coughing,
tell them to stay at home.
I ask them to stay at home so that they don't create a situation where they transfer this infection to others.
To other people. Okay, one more call before we call it a day on today's edition of the RoundTable. Hello? 08162519991. Hello?
Hello, sir.
Hello, good afternoon. Turn down the volume of your radio set.
Okay, sir.
Please, your name.
My name is Monday.
Okay, Mr. Monday, where are you calling from?
I'm calling from Owo.
Okay, go ahead, please.
Please, sir, I just want to know this Lassa fever, this corona, this virus. Is it the same thing?
It's not the same thing, no. Like we have said, that it's not the same thing. Although they are both viral infections, but they are not the same thing.
Okay, I think that's the last call we'll be able to take because of our time. I want to thank the Honorable Commissioner for Health in Ondo State, Dr. Wahab Adegbero. Thank you for coming.
Thank you, sir.
And the epidemiologist, Dr. Stephen Fagbemi, thank you very much for coming.
Thank you.
I'll really say that I think government still needs to do a lot of enlightenment because from the questions people are asking,
I think
you know that people really don't.
I think you can also help us.
That's what we're doing now. It's part of our corporate social responsibility. That's what we're doing now.
We appreciate that.
Okay, this is where we draw the curtain on today's edition of the RoundTable. We'll be talking about coronavirus. My name is Oladimeji Daniels. Keep the dial locked on this frequency. Thank you for listening.
8.9 FM.